Should some doctors watch what they say? Most in the healthcare field, they don't seem to know how detrimental their words and actions really can be. Hey folks, I'm Dr. Jeff Williams, and in this video, I'm going to discuss one of my greatest pet peeves and greatest disappointments that's happening in healthcare clinics, not only traditionally, but also today, currently. I'm also going to share some personal experience from my patients right here in my clinic that's going to demonstrate exactly what I'm talking about. Now, I can't stress enough, you've got to share this video with your people so that they don't fall into this trap, and I am deadly serious about this. We've all heard about providers with bad bedside manners, right? I see that as a provider that just doesn't seem to be good at communicating. They're a bit quiet, maybe reserved, maybe egotistical, and a little bit aloof. They have zero interest overall in any kind of relationship with their patients. And while I personally believe that that's probably the wrong way to go about being a caring provider, that is not what we're going to be talking about here for the rest of this video. What I'm referring to, for me, is abominable. It's bordering unforgivable. And it's proven time and time again in conversations with my patients that providers of all kinds have yet to get the message. And the message is that harmful words and poor communication can absolutely hurt their patients and destroy their patients' chances of ever climbing out of pain. When helping a patient recover from pain, especially long-lasting pain, some of the primary concerns that we're looking at addressing here are warning signs. And some of the warning signs can include maybe being afraid to move, avoiding activities that our patients love to do because they're afraid that they're going to pay for it with pain. Depression is definitely a warning sign. Being sedentary, anxiety, and having sleep disorders. Now, more has been learned about pain in the last 10 to 20 years than has been known in the previous 1,000 years. Whereas versus 10 years ago, we now know that these issues are some of the first things that we need to address with our pain patients. But how do these things develop, and what do they mean? Well, chronic pain doesn't just happen overnight all by itself. It develops over time, and it can be a bit like the World Trade Center's collapse, or kind of like a string of dominoes. There was one thing that happened, and then it piled on to the other things, leading to quite an incident, right? So again, one led to the next, which led to the next. And here's the kicker, though. The first domino can be how the patient is treated by the provider. Too many providers still look at pain as something that's caused by a simple malfunction. But the more recent way, according to research, to look at it is to approach pain through the biopsychosocial way of seeing things. It's a three-part equation, and it may have started with it, but it's not just a body part that messed up. Things like a person's feelings, thoughts, and beliefs play a big part. That's the psycho part of pain. Then there are other factors, like a person's job, their income, their level of support at home, and their beliefs about healthcare providers. That's the social part of it all. All of the biopsychosocial aspects of pain have to be addressed to get our patients where they want to go, which is being pain-free. We can be instrumental in changing their lives for the better. On the other hand, we can also be instrumental in changing their lives for the worse and dooming them to a lifetime of chronic pain, inactivity, and poor health, all by the way we manage their case. Now, that may sound dramatic to some, so I want to be more specific, and I want to break it down and explain exactly what I'm talking about. Here's how the process sometimes plays out. Some providers order X-rays or MRIs when they're not necessarily needed. Then sometimes it's because they aren't well educated on guidelines for imaging. Sometimes, in less ethical instances, it's so that the doctor or the provider will have a tool to scare patients into lots and lots of visits or more serious and well-paying surgical interventions and treatment. They don't communicate the findings from the imaging properly to the patient, or they make terrible analogies that cause undue and inappropriate concern in the patient's mind. Things like, it's not a matter of if you'll have surgery, but when you'll have surgery. Things like, you have a spine like a dried twig. Things like, I'm really concerned about your future. If we don't get this curve in your neck restored, we have to get to work today. This is serious. And then there's other things like, you have the back of an 80-year-old, but the patient is like 45. What do you think these things do to people's minds? Well, the patient begins to catastrophize the findings, making them worse than they actually are. And they believe they're fragile, abnormal, and on the verge of some sort of serious injury. And because they believe that now they're fragile and on the brink of injury or danger, they begin to back away from activities that they love because they're afraid of getting hurt. And that's called fear avoidance. And once you start backing away from conditions or from things that you love to do, you start to decondition after just about 7 days. Think about when you put a cast on an arm. 6 weeks later, you take it off. It's smaller than the other one. You haven't been using it. Well, when you start backing away from things that you love to do, you start to decondition. And it's hard to get it back. And some patients are afraid of any movement at all after they're treated like this. My patient was told that her spine was like a dried twig from osteoporosis. She was afraid to walk across the room, and her daughter was scared to death. And when we stop moving and stop being active and exercising, we become sedentary. In the middle of all this storm and collapse, the patients tend to develop deeper, more entrenched pain. A sedentary lifestyle adds to that, and it leads to depression, anxiety, and sleep issues. And when you combine it all with more severe pain that's going on, well, you move even less. You become even more sedentary. All of these are based on the handling of a patient from the very start by one very ignorant provider, ignorant of guidelines and recommendations, ignorant of when to use imaging, ignorant in the way that they use words to relay the image findings, ignorant of the impact that their actions can have on a patient when they leave their clinic and try to go back through their lives in the coming months and years. Ignorant at all points. So let's compare communication, and you keep score in your mind on which you would rather your child or your parent experience if they were to go to a healthcare provider. Let's say we've got a 28-year-old patient with low back pain. The pain's just been kind of hanging around for 6 months or more. And one provider does it wrong, and one provider does it right. So you compare. Here's the provider that does it wrong. They order imaging immediately. They tell the patient they're messed up because they have some degeneration, a disc bulge maybe, and they need to be seen maybe 35 times to get over this issue. They tell the patient if they don't do what the provider says, they could suffer forever. They tell the patient to slow down, take it easy, don't overdo it. Wear a back brace to protect yourself, and wait until you get to feeling a little bit better before you get very active. And then they write the patient off work for 2 weeks. Now here's the provider that does it right. This provider knows that the national guidelines suggest, in the absence of anything overly concerning, a red flag, that the patient should be conservatively treated for 2 to 4 weeks before ever thinking about getting some imaging. If there's no improvement after 2 to 4 weeks, or the patient gets worse, then of course, let's get some imaging. Assuming the patient has imaging already, this provider chooses not to allow the patient to think that they're somehow broken and fragile. Instead, the provider tells the patient that almost 30% of 20 to 30-year-olds with no pain at all still have a touch of age-related findings on imaging. And while you might have a little bit on there, it's nothing at all to worry about. It's very normal. This provider likely doesn't even mention a slightly bulged disc because it's usually of no consequence whatsoever. It's part of normal findings. Instead of building a case for catastrophizing the patient's complaint, this provider tells them that they are young and strong and healthy. And this provider tells them that just a couple of weeks of focusing on treatment should get them well on their way to getting over this complaint and being able to control it at home. This provider tells the patient to only wear a brace if they're doing something particularly strenuous or laborious and they feel maybe they need a little extra support temporarily, only while they're doing this activity, and they take it right off. And they only do that until they're feeling better. They also tell the patient to get to the gym appropriately, responsibly. Go for a walk. Movement is healing. Motion is the lotion for our joints, and hurt almost never means harm. This provider reminds the patient that if those that have been hurting for a long time wait until they stop hurting before they move, they're going to be in a lot of trouble. So let's get moving. This provider, the one that does it right, keeps communication helpful, supportive, encouraging, and optimistic. Now that I've laid all the differences out, which would you rather yourself or your family be exposed to? Well, the answer is clear to anyone with common sense, but it's also clear in the research literature, time and time again. One story real quickly before I wrap this up. A recent patient in the early 20s, 21 years old to be exact, came to see me with back pain. The previous chiropractor took x-rays outside of guidelines. This patient did not need x-rays. They didn't have any red flags saying, I need some imaging, right? Yet the x-rays were taken regardless. Then this predatory provider used the x-ray images as a tool to convince the patient that they were broken somehow and they needed a lifetime of chiropractic care. The patient was told that the big issues were as follows. This patient was told that they have head-forward posture, which means your head sticks out a little bit. They were told that they have scoliosis. And then they were told that there was some degeneration in their neck. Well, so let's break that down. This patient is convinced now that something very, very serious is wrong with them. And they are afraid to exercise or even go to the gym because they're afraid of building muscle on top of the problems that they were told that they've got. Now, do you see the problem here? A perfectly healthy 21-year-old is afraid now to even go to the gym because of how they were handled by this provider. Here's the thing. I checked the posture in the most comfortable position, and they had basically zero head-forward posture. If there was any, it was extremely minimal. I checked for scoliosis, and if there is any scoliosis on the x-ray, I promise you it's minimal and definitely not worth scaring anyone over. With regard to the degeneration finding, this is one of the more inappropriate things to point out and make an issue of to a 21-year-old. For some, it's normal to have a touch of it, but it causes zero pain and zero limit in function. And what would be the point of even sharing this with a patient if for no other reason than to freak them out and scare them into more and more treatment? I can't describe how harmful this sort of communication, handling, and treatment is to a patient. And that harm can be lifelong harm, all in an effort to pad the bill and make an extra boat payment. It's not just chiropractors. Trust me, I've heard some of the most insane things in my 24 years of practice that came from medical providers themselves. The point I'm making is, it's not profession specific, it's all of them. If you or your family member has been or is being handled in this manner, I hope you will call us here at Creekstone Integrated Medical. We want to treat you right. We want to treat you like family because you are a part of our family when you're one of our patients. We'll get you on the right track and we'll do it the right way. And if you're in the Texas Panhandle or you're going to be traveling through Amarillo and you need to be treated, why don't you call us at 806-355-3000. Let's get you on the schedule. If you're watching on Facebook or YouTube, share, share, share. Like and comment too. Until next week, stay smart and we'll see you then.